Today, we will discuss advanced care planning. Advanced care planning is not only a core measure that benefits our patients for reasons we will explore here today, but it is a CMS quality measure that impacts patient care as well as Medicare reimbursement. Advanced care planning is similar to planning for retirement. The better prepared and planned for, the more satisfying will be the outcome. The time for advanced care planning is when you are in good health with options and the cognition to clearly express wishes to family and loved ones. Advanced care planning in an emergency is worst case scenario, but tragically, for too many families, end of life decisions are not made before there is a crisis. The impending loss of a loved one is compounded by uncertainty and grief. Indecision among family members trying to come to a consensus in the midst of fear and grief. I have no relevant affiliations or disclosures. The Geriatric Workforce Enhancement Program is a federal workforce enhancement grant funded through the Healthcare Resources and Services Administration. One of the major goals of the grant is the promotion of age-friendly healthcare system. Age-friendly healthcare is a concept pioneered by the John A. Hartford Foundation and the Institute for Healthcare Improvement in partnership with the American Hospital Association, the Catholic Health Association of the United States, Kaiser Permanente, Trinity, and Ascension. According to a literature review published in Population Health Management in August 2018, research indicates that older adults receive only about half of their recommended care, with varying quality and limited attention to social issues impacting their health. Furthermore, the literature reflected limited evidence of efforts to tailor quality measures for the unique social needs of older adults, confirming a potential gap in that area. The expectation is that filling this gap will improve overall understanding of seniors and help them to achieve optimal health and successful aging. In September 2018, the John A. Hartford Foundation and the Institute for Healthcare Improvement, in partnership with the aforementioned partners, took up the gauntlet and launched the first age-friendly healthcare system in the United States. They began to change the face of geriatric care in this country. Dr. Pandya is the driving force and the principal investigator of the South Florida Geriatric Workforce Enhancement Program, who together with community partners is bringing South Florida to the leading edge of this national movement with the goal of transforming the clinical environment through the training and implementation of age-friendly healthcare. The theoretical undergirding of age-friendly healthcare has pivoted from an academic groundswell that explored the need for an age-friendly health system to the Geriatric Workforce Enhancement Program, which refocuses on the clinical training of the workforce in conjunction with implementation of the nuts and bolts of the age-friendly health system. The achievement of measurable clinical outcome goals proven to benefit the elder adult, also known as merit-based incentive payment system, gauges the success of implementation. The goal for this presentation is twofold. First, we'll explore the 4M's framework and how integration into primary care creates an age-friendly health system where the patient is reseated as the decision maker in concerns that matter to them. Second, in this presentation, we will explore principles of advanced care planning, why it is that encouraging our patients to think about care they may desire to receive, or conversely, rather not receive at the end of their life, matters to them and their loved ones, and ought to be considered before crisis meets them, as inevitably it will meet us all. Keeping in mind, as difficult as broaching this subject is, that this is their life and their decision to make, and we as healthcare providers are well equipped to guide them. Age-friendly healthcare and the 4Ms. The 4Ms are the framework or the infrastructure of the age-friendly health system. All care given in an age-friendly health system is driven by a consideration of 4 evidence-based concerns that are vital to the elder adult. One of the primary goals of the GWEB is to transform clinical environments where clinicians meet patients to achieve measures vital to the successful aging of the elder adult. These 4 evidence-based concerns are what matters: This is to know and align care with each older adult's specific health outcome goals and care preferences, including but not limited to end-of-life care and across care settings. Medication, if necessary, use age-friendly medications that do not interfere with what matters to the older adult, mobility or mentation across settings of care. Mentation, prevent, identify, treat, and manage delirium, depression, and dementia. And mobility, ensure that older adults move safely every day in order to maintain function and do what matters. Advanced directives, what is it? Why should I plan? When is the right time? And can it be changed? What are advanced directives? These are preferences for care expressed in legal documents that become effective only when one becomes incapacitated. However, patients with decision-making capacity have the right to defer decision-making to others should they choose. These directives must be in writing, signed, witnessed, and notarized. Advanced directives are invaluable as legal documents that advise loved ones, healthcare surrogates, and medical personnel of the individual's preferences for end-of-life care. These legal documents go into effect when the patient is incapacitated and unable to speak for him or herself. Advanced directives include the designation of a healthcare surrogate, healthcare power of attorney, also called a durable power of attorney, a living will, and a do not resuscitate order, which is written by a provider based on patient wishes and placed in the patient's charts. Advanced directives allow you to express your values and desires related to end-of-life care when you are the most vulnerable. Again, these directives must be in writing, signed, witnessed, and notarized. The healthcare surrogate. Healthcare surrogate is a trusted family member or friend who would make decisions based on knowledge of what care the patient would prefer. This may be one person or a group. However, for clarity, best practice would be to have a single person designated with an alternative person designated should the primary healthcare surrogate be unable or unwilling to make needed decisions. Encourage your patient to discuss his or her wishes with their healthcare surrogate and family members. Healthcare proxy. This is where things can get complicated. When no healthcare surrogate has been designated, established law in the state of Florida spells out who would then act as the decision maker for the patient in the following order of priority: the spouse of the patient, the adult child of the patient, or a majority who are available for consultation, a parent of the patient, an adult sibling or majority of adult siblings who are available for consultation, an adult relative of the patient who preferably has been in contact with the patient, a close friend of the patient, and lastly, if none of the above are available, a clinical social worker or one who is a graduate of a court-approved guardianship program. Any healthcare decisions made under this part must be based on the proxy's informed consent and on the decision the proxy reasonably believes the patient would have made under the same circumstances. At all times, as possible, the decision maker should be making decisions that the patient would have made or she or he had capacity. So we can see that this is not the optimized end-of-life care. Healthcare power of attorney is also called a durable power of attorney. It's a document that expresses a patient's specific wishes during periods of incapacitation. A healthcare power of attorney may also designate a healthcare surrogate, who is a person or people, to speak for him or her should they be unable to speak for themselves. A living will. The living will details the kind of care one would desire to receive near the end of life should he or she be unable to speak for themselves. This is a document that is flexible and may be modified by the patient as desired. It may include decisions about the insertion of endotracheal tubes for artificial ventilation, feeding tubes, initiation of dialysis or other invasive procedures, and under what circumstances. Decisions about withholding medications, liquids, or food under certain circumstances, Decisions concerning withdrawal of ventilators, IV fluid, or feeding tubes should their condition not improve as hoped for would also be addressed in a living will document. Ultimately, a living will may indicate a desire to withhold cardiopulmonary resuscitation should their heart stop or under circumstances unacceptable to the patient. Do not resuscitate. This is a document based on directives set forth by the patient that lets family and providers know at what point an individual would prefer life-saving measures to stop. Optimally, these directives would be in the living will. This may be tailored to detail what care is to be continued and what is to be stopped, or it may be a blanket document indicating that all life-saving interventions are to be withheld or withdrawn and under what circumstances. It is instituted by a physician's order based on what the patient wishes, and the signed document is to be placed in the patient's medical chart. Research shows that people who document their preferences for end-of-life care are more likely to get the care they prefer at the end of life. Encourage your patients to ensure healthcare and financial arrangements are in place before a serious illness or healthcare crisis arises. Start discussions early with loved ones while everyone can still help make decisions. Create documents that communicate healthcare, financial management, and end-of-life wishes. Review plans regularly and update documents as circumstances arise. That's the beauty of a living will. It may be modified by the patient while the patient is cognizant. Put important papers in one place and discuss end-of-life wishes with trusted family members and friends. Share documents with healthcare decision makers, your family or friends, and providers so everyone is aware of your end-of-life decisions. Give permission in advance to providers or attorney to speak directly with family and caregivers as needed. Conclusion. Advanced care planning is a part of living your best life. It matters to you and it matters to your loved ones. If you have any questions, please feel free to email me at dk644@nova.edu. Thank you for completing the survey. I hope you learned something and enjoyed the presentation. If the link above does not work, please scan the QR code. Thank you and be well.